Now you can simply pause this video and you can try to find out where is the problem. Now if you can see closely, this is the CT scan of the brain, and what is evident on zooming is there is subarachnoid hemorrhage. Now I have told earlier also, dense white structure on CT scan of the brain is bone, blood, calcium, or contrast. These are the four things which can be seen very dense white on the CT scan of the brain. Now, this is the bone. This is as dense as we say blood. Blood is as dense as bone on CT scan. Now, what we can see in here is you can see this whitishness. This is hyperdense. This is all blood. This is all blood because this is a subarachnoid space. This is a very, very typical of subarachnoid space. If you can see, this is hyperdense, dense white structure. This is all blood. And not only this is the blood, this is also the blood only. So this dense white structure is all blood. So if you can see in this image, we don't see this blood anywhere. The subarachnoid space or the sulci, gyri, these are pretty clear. There is no blood. So if you can simply zoom out and if you can see, you won't see that much of blood anywhere else, especially in one direction. But when we see in here, if you can trace it in this image, we don't see any blood. Uh, See, this is the cerebellum. This is the cerebellum. This is the posterior fossa. This is the posterior part of the brain. This is the nose part. We can see these are the nasal sinuses, maxillary sinuses, and this is the cerebellum. This is the cerebellum. This is the posterior aspect. This is the posterior cranial fossa. This is the cerebellum. We know this is the foramina magnum where the spinal cord starts. So this is the ending. This is all medulla. This is all medulla. This is all medulla. These are the cerebellum. This is the cerebellum. This is the medulla. Above medulla, whatever uh, the round structure is pons. So this is all pons. The perfectly circular structure is pons, and above the pons, the butterfly-shaped structure which is there is midbrain. So this is midbrain. So these are the two wings. This is one wing. This is the one wing. This is butterfly shaped. This is midbrain. So this is the part of midbrain. So this is the brain stem. Why I'm telling this brain stem, and because these are very important structure where we have to look very, very carefully. One of the most important structure which we see in here is the basilar artery. So basilar artery actually forms by the joining of two vertebral arteries. So two vertebral arteries actually come up and they form and join the basilar artery, which we can see. The hyperdense dot just in front of pons is basilar artery. So this is the basilar artery. This is very, very important because basilar artery strokes, bleeds are extremely dangerous because this brainstem, this pons, midbrain, medulla, they contain the vasomotor centers, respiratory centers, blood pressure centers, vagus. So if the patient gets infarct or bleed in this brainstem area, most of the patients are brain dead within 24 hours. So aggressive treatment is very, very important, whether it is infarct or whether it is bleed, whether it is subarachnoid hemorrhage. So here there is no apparently any bleed, which we can see here. Here we don't have much apparent bleed. So as soon as we are reaching here, so as we can know, this is around this here, the midbrain is starting. This is pons from this area to here, it is pons, and pons almost ends here. So we have top of basilar artery here. So basilar artery almost ends here and then gives the posterior cerebral arteries, the main two branches, which actually forms the circle of Willis. And here, this is a very common culprit area because if someone gets stroke here, ischemic stroke or a clot here, the patient get very bad ischemic stroke and patient can die. Or someone gets an aneurysm here, the patient bleeds to hell, patient gets subarachnoid hemorrhage, and those patients get dead very, very fast. Here also, the same thing has happened. Here at the top of this basilar artery, we can see that there is so much of hyperdensity which is arising here. So you can see here that there is so much of hyperdensity arising here. You can simply see there is so much of dense white blood is there. Here it is pretty clear. This all is blood which is spilled because of the rupture of the top of the basilar artery, which can be localized, which have to be very carefully seen. Always look for pons and the top of pons where the midbrain is starting, and this is the bleed. So in short, the bleed has started here, so it is all bleed. And this was a very, very typical top of the basilar artery aneurysm, which had bleed, which led to subarachnoid hemorrhage. This, as you know, this area is very, very small and it is very, very difficult to approach neurosurgically. It is very difficult. It's very difficult area to assess this area. So the best treatment most of the time is to do the CT angiography. After that, DSA is done, and this top of the basilar artery aneurysm has to be coiled, and that the bleed has to be stopped. So if you can see here, we don't see any bleed. Here 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 we don't see any bleed. But as soon as we come here, see, look here and here. So this is the spilling of this blood. Here also there is spilling of the blood. Here is the spilling of the blood which is arising from the top of the basilar artery. So this was a very interesting case of top of the basilar artery Berry's aneurysm which ruptured, which underwent coiling, and then only the patient was better. Thanks for watching.